So most people have probably never heard of Neurode, and so let's just start off with like what is Neurode and why are you trying to solve like ADHD without the use of drugs?
hmm So, Neurode is our startup that makes a wearable headband that treats and tracks ADHD, basically improving focus, memory, and impulsivity in 20 minutes a day from home without drugs. And at its core, it is leveraging two technologies. One is for increasing brain activity. So, it's the way that we improve focus. And then the second is FNIRS, or functional near infrared spectroscopy, and it's how we measure the brain. And that's the tracking part. And why do we do that? Um, I have ADHD. I'm also a neuroscientist, and I've tried so many medications to try and improve my focus, and they just came with side effects that like were intolerable for me. And I think that has been echoed by a lot of people. Like, not only do the side effects suck, they're hard to access. It's just really difficult. And so I wanted to have something that would improve my focus, not just in a day, but over time, without side effects. And so that's why we're working on Neurode. But outside of that, I mean, it's not just ADHD. I think the mission behind that mission is actually for us to understand our brains better, because our brains influence everything we do, everything we think about, and influence so much of how the world, like, I guess it influences so much of how the world ends up, because how we just the decisions we make, the discoveries we make, the innovations we make all come from our brain. So to be able to understand the brain will unlock so much more for, I think, humanity, but then maybe more specifically for how we interact with our brains. So once we understand a system, we can influence it more. And so being able to do that would mean we could help not just ADHD, but a whole bunch of other brain-based conditions.
I know that you were diagnosed with ADHD when you were like 5.
Mhm.
How did your family like decide to go get you tested? And then like what was it like growing up with ADHD?
Yeah, so my parents like didn't like guess that I had ADHD. My teachers called my I was 5 years old. My teachers called my parents and they were like, "There's something not quite right with her." They thought I was deaf, or blind, because, which is like, it seems ridiculous, it seems like a joke, but that was genuinely the call my parents got. They were like, "We think that she has hearing problems or vision problems." Because she's like, in her own world, sometimes we'll call on her in class and she will not respond.
Hmm.
Um, and we're not sure if she like can't hear us or if she can't like see what we're working on, but there's something going on.
What you're like they're asking you to do?
Yeah. And so I think it was like, and so they got my eyes checked. They checked my hearing. They were like, and my parents were like, "What do you mean?" She's like, we definitely confirmed that she can see and hear things. Um, but yeah, they got me tested, like for a whole bunch of other things. And it was like, no, not my vision, not my hearing, not, anything else. Um, and eventually they were like, "Oh, she's not paying attention." So something that when I'm very focused, or as a kid, very in my own world, in my own imaginary world, um, my internal world was as loud to me and as salient to me as the external world. And so when people were calling my name, it wasn't that I couldn't hear them physically. It's that like I was so absorbed in my own world that I couldn't like even hear when they were calling on my name.
It like
Um,
your like internal stuff was just kind of like the overriding
yeah.
thing,
And to
or
be honest, it's still like that. Like if I'm in hyper focus at work and someone like is like, "Hey Nat,"
you're
no
like fuck
response.
off.
You need to like physically tap me sometimes to get my attention if I'm really dialed in on something.
Really?
So yeah. And so growing up with ADHD, like, I mean, my parents didn't make a huge deal of it. I feel like pretty lucky in that sense. Like, I think it's different for every person. Like, what was right for me was to be like, and she's fine. Just figure it out. And what might be right for someone else would be like, okay, we need like special, like some people like really benefit from like special concessions and having like longer time on tests and things like that. But I remember, for me, what happened was they put me in special ed classes, and I remember sitting in the assembly room for the special ed kids, like spelling my name in plasticine, being like, something has gone very wrong. I just remember I have this vivid memory of like spelling my name in this like bright orange plasticine, being like, I don't know how I ended up here. And then like 2 weeks later, they moved me to like some accelerated classes.
Huh.
And they were like, okay, so she doesn't need like special attention. She needs maybe to be challenged. And so then I went to accelerated classes. And that kind of also was difficult because I was like, yes, I'm challenged, but like, so like I'm focused better here. But ultimately I like, regular classes were good. My parents tried medication for me. I constantly felt sick, and so they took me off it. And
How
eventually
many medications did you try before you just kind of like either found one that worked or stopped trying?
stopped trying. I don't know how many my parents gave me because they weren't like, oh, we're like trying to treat your ADHD. Blah, blah. They were just like trying it and be like, how do you feel? And like I eventually was like, I feel sick on all of these and I don't like it. And then they stopped. And I would be maybe like 7 or 8, I think,
Hmm.
when I stopped. And then I tried again in high school because they were like, your final exams are coming. Like you really want to like do
You got to
well, get
cram.
in, you
Yeah.
go to like university. And I had like never done homework at that point. Like I was one of the like lucky kids that didn't have to do homework, would just like be fine in class. Like even though I was really inattentive, I could just get through school with decent
You're smart
grades.
enough to just like kind of coast or
Which
whatever.
yeah, which really came back to bite me in the ass at university. But still, and then I tried different meds in high school. I think I tried Ritalin. I tried which is methylphenidate. I tried dexamphetamine.
Isn't that like literally just meth?
It's a l- it is an amphetamine. So it's in the same class of drugs. It's pretty similar. It made me really wired, and like I felt really weird at school because I think in high school you want to fit in, and I already didn't fit in. But then being like hyped like on stimulants did not help. So I really didn't want to take them, and I felt really weird on them. Um, and so yeah, I ended up trying a couple things in grade 10. Um, and then was like, nah, I can't do this.
Yeah.
It's just
Did you initially like get into or become interested in neuroscience because you had done this and kind of gone through this ordeal, or was it just internal fascination?
I would like to say yes, but to be honest, it wasn't the biggest thing that made me interested in neuroscience, like my own personal ADHD journey. I think because my parents were like, for the most of it, they're like, you're fine. Um, I it was actually a little later that I think I always was fascinated by how our brains work. Maybe it was because I was a little like different at school that I was always like interested in how other people were, how they were. Like I was probably a little weird. And so like other people's internal worlds just fascinated me always. Like, when you like go to family reunions and stuff and see family members that you haven't seen for ages and they pinch your cheeks and like, I've known you since you were this big. Like those kind of aunties would always tell me, you were the strangest kid. Like you used to come up to us when we were like the adults were talking and be like, what are you thinking about? Like, do you remember your dreams? Like you would ask the weirdest questions like to all the adults. And so I think I was always inquisitive about people's internal worlds. And then after high school, started getting really, really interested in how our brains work just because of uh, how little we understand about our brains, but how impactful that understanding would be. And I was like, how can it be that we understand so much about so much of the body, but not our brains, when our brains influence our everyday life the most? And so, really, it was like a fascination with understanding the brain for what that would unlock for humanity more than
Than
my own
anything
personal
else?
experience. But yeah,
Yeah. So when you got to college, I believe you studied in Sydney,
yeah,
or right? Yeah. Uh,
UNSW, yay.
so I know you met your co-founder Damien
Yeah.
at university. Can you like tell me the story of how that happened?
How we met?
Yeah.
Yeah. So I decided to join the Latin Dance Society because because the university was like I was like I kind of got really into studying at university for the first time in my life. So school I was the like kid that never did any homework, just like showed up. Um, and luckily did okay. University was the first time where I actually had to like learn to study. And then I got really into it. And so I was like, I don't know why I took university so seriously, but I was like, and so I thought Latin dance would be a good way to like have fun because you kind of can't not be smiling and laughing while trying to do Latin dance for the first time, like in a group in front of people. Especially like it was like mostly like science, like STEM kids. So just the awkwardest people you could imagine trying to do Latin dance. It was hilarious. So I joined and I started talking to someone while we're dancing. Like, what do you study? Oh, I study this. What do you study? And then I somehow went on like this rant about how like the intersection of neuroscience and technology and how impactful it would be for humanity to this poor unsuspecting like other student. And Damien was dancing with someone next to me and he heard me talking about it, and then he jumped in. He was like, while we're dancing with other people, he's like, I'm really into this too. So we started like a parallel conversation because like you could see this other person's eyes had just glazed over. And so we started chatting, and then we were like, do you want to switch dance partners? Okay, cool. And we switched dance partners and started dancing and mostly just talking about our obsession with what can be done with him on the hardware and digital signal processing side, which is really his passion, and me on the neuroscience side. And within 2 weeks, we had like agreed to do a skill swap where he would teach me hardware, electronics, and digital signal processing, and I would teach him how to like interpret the data and add that domain knowledge to it. And yeah, within 2 weeks, we had ordered electronics from China, started building EEGs, EMGs, all these different things to measure the brain and body. And yeah, that was from there.
What were the first kind of like, not necessarily products, but when you were tinkering on stuff with
Mhm.
him, what were the first few things that you guys made together?
EEG and EMG, so measuring brain waves and muscle uh, changes in like muscle. Um, and so yeah, we thought like, oh, and heart rate sensors
Mm.
as well. They're all basically like very similar electronically. And so we were like, you can build like them all pretty
Is it just like
similarly.
measuring pulses kind of
It's
thing?
measuring changes in electromagnetic
Mm.
fields generated by your heart rate, your muscles, and your brain. Um, Muscle ones are nice and big. Brain ones are really tiny. And so yeah, we like were coming up with these like elaborate useless use cases. Like, wouldn't it be cool if we went to a party and gave everybody a heart rate sensor that also tracked your location, and then we like mapped on some kind of like digital artwork where everybody was at the party, and when people interacted with each other, like did their heart rate sync? And we were planning to do these things. And you can imagine we were very cool at parties. But yeah, that's what we were building.
Yeah. Why did you decide to not like start a company with him in college?
Because we were so obsessed with the stuff we were learning. Like we were the people who were Damien and I both were like working in labs for the whole of our degree, obviously for free, sometimes paid. So we would bug all of our professors to be like, can we come in the lab? We want to see what you're doing. We want to like be a part of it. How can I help? I think Damien was doing really cool stuff. Like he was working with one professor doing a LiDAR sensor for when people fall in their homes. Or he was working in quantum computing. He was building like his own projects, like a shoe that would, for blind people, that would detect when you were going to fall, or there's something was in your, or something was in the way of your foot. And he had a really good name for it. He called it haptics, like because
Haptics.
it would vibrate like haptically on your shoe. So like we were just like, he was doing that. I was bugging all my professors to let me in their labs, like doing like rodent experiments, like little brain surgeries and measuring their brain activity while doing different things. So yeah, we're just really engaged in the stuff we were learning.
I don't know what the company is called that you went to work for, but what was you were building these machines that cost a whole lot of money. I think at like
Hmm.
$500,000 or something for
Yeah.
measuring brains
Hmm.
in some way.
Yes.
What was the inception of like the idea for Neurode while you were working there?
So I was working at a bionics company. We were doing predictive models of cochlear implant success. So like, how do we know before you do your surgery if your surgery is going to work well? And basically, this is about modeling neuroplasticity. So how your brain changes and adapts over time. So when you put an implant in, you need to now relearn how to interpret those electrical signals as meaningful sound. And so I was building this model with data collected by a $500,000, bigger than a fridge FNIRS machine. So FNIRS is functional near infrared spectroscopy. It's a way of using light to measure changes in blood oxygenation, and we use that to learn about brain activity. So similar sort of metrics to MRI. And what I learned in that role, which I think is probably pretty contrarian to where the whole sort of field was moving at the time, which was everyone was saying the data's not good, like the data's not high quality enough. We need more sensors, bigger equipment, which resulted in more expensive equipment. And my experience from that work was actually the data was pretty good. Our models were good, but it wasn't translating into the real world. Like, it was really disappointing for me. In my first job, I was like shiny-eyed out of university and then built the models and they were pretty good, and seeing them not translate, ultimately not being able to help people, because it just didn't make sense within the healthcare system. It was too expensive. It was inconvenient. It was all these things. And so I realized, actually, if we could make these devices smaller, less expensive, more accessible, and kept the data quality the same, like, and just had more data, because obviously if your device is big and expensive, you are limited on the amount of data you can have.
Yep.
So actually, if the data quality is the same and we have like 100x more data, would that be impactful? And so I thought yes. And like the work I had doing had indicated to me that that would probably be the case. And so I called Damian, who was finishing up his postgrad in physics at the time. And I was like, is this a physics thing? Like, is it a physical property of the world
Is
and
it
how
just
these things
impossible to
work?
do?
Yeah, is it just like not possible
Or
to make
just
these
someone hasn't
smaller,
done it
cheaper? Like,
before?
yeah. And he spent like a long time. Well, he just kind of got obsessed with it for the like 2 weeks, really trying to find a reason why not. And he came back and he was like, I don't know if I'm an idiot here, but like I could not find a reason why we couldn't. And so then we just like started. We started, like, he's such a legend. Like, he was finishing up his thesis while starting to work on this project with me, still won like best thesis award at university, and started Neurode with me at the same time. And I quit my job and we just started building. And then within like a couple months, we had 100x cost and size reduced the core technology, without any loss in data quality. And that's really impactful because today, like, if you think about even MRIs, which are like the gold standard of high quality brain imaging, people might get one MRI in their lifetime. They may
Yeah.
not get any.
It's just
If
a
you have
huge
it, yeah,
hassle.
it's huge.
Yeah.
And it's so expensive. And like the kind of disorder, like the severity of disorder you would have to have in order to get MRIs every year is like pretty significant. And so we don't actually know what the brain looks like on a daily basis. And so the cool thing about Neurode, I think, is that while we're solving a problem for people, like we're improving their focus, memory for ADHD, we're also imaging their brain every day to actually understand, what the human brain looks like on a day-to-day, what fluctuations are significant and what fluctuations are just normal. And so, and like background noise. And so it's kind of like a first to start understanding that. And I think, the nerd in me is super excited by that, but also I think there's like a huge amount that we can do with that data to basically help people
Understand how their
navigate,
brains
yeah,
work better.
understand how their brains work better, but also that means we can help navigate like brain-based conditions so much more effectively.
Yeah. How long did it take in between? I know that you said like a few months. How many iterations did you make of, going from zero to something that was actually usable, functional to just try?
I'll show you in the other room. We actually like have a wall of all the different versions. We're currently at 6v6.4.
Really?
Yes. And so many. But no, it's been like like the size, the jump of iterations like that we're doing has obviously reduced because we started out with a like a pretty big PCB, and it was not like
It was
super
not comfortable
wearable.
or
No, no,
nice.
no.
No.
It was taped
Pretty.
together. It was crazy. And then I think 2 or 3 iterations in, we were at like the general form factor. And then it became more like optimizing performance and also optimizing usability. And so that's where we came with so it used to be something that was like this, and everyone said it looked like a VR headset, and we were like, true, it does. So then we changed the shape again, and it was comfortable, but only within like the kind of, if you imagine like a bell curve, only within like the highest average of head sizes. And then so we started changing the mechanics, and now we can fit like, I would say like 95% of head sizes and shapes, which is cool.
When did you decide to first start? So I know that you started the company in like 2021.
Mhm.
When was the first time that you were like, okay, we need to take this seriously and like make this a company?
I think it was the first and like honestly our core technical innovation on the brain imaging side when we got that data back. So basically we had built this thing. We then went into the lab. Like I called, like lucky we had been like kind of became friends with our professors because we were always like working for them through university. So I called them and I was like, can I come into your lab? Do you have one of these machines? We've just built something and we want to see if ours like works as
Works at
well
all.
as yours does. And they were used to this as a point. Like our professors had lent us so much lab equipment over the years of us like trying to do stuff. And so it's when we saw those readouts and the data was like exactly the same. And we were like, oh shit, did we actually
We
do
might
something?
have something here.
Yeah, this is actually really cool. Like we couldn't believe it ourselves. And it was then when we were like, okay, this is gonna be really impactful. We just need to figure out like now that like this, and there's, to be clear, like many technical hurdles that we've like, this was maybe 4 months into working on this that this happened. Um, maybe a little less, maybe 3 months. Um, but and there was many technical hurdles after that, but it kind of became then the question of like, in what scenario does it make sense for people to measure their brain daily, and how, and like what is the value that they get from doing that, which allowed us to kind of like zoom in.
Wait, so did you guys initially start this with just thinking about measuring brain
Yeah,
activity and not at all about the ADHD part?
no, not at all.
Okay, so
We
how did you
it
make that transition?
Yeah, I think it was like this interesting like collision between my personal life and some scientific interests and Damien's as well. So we started out obviously brain data nerds, really excited about like this didn't start off of like we should start a company. It started off as like, wouldn't it be incredible if
And you
we could
just
measure our
wanted to
brains in the
try.
real world?
Yeah.
And then we were like, well, now that we know that we can, like the worldview changes where you're like, okay, we can measure the brain in the real world. How is this helpful to people? And then I was like, well, I've been looking for drug-free treatment for my ADHD. I've been researching what the options are, given like the general like medical view is like medication or
Medication.
therapy.
Yeah.
And so I had been looking into that a type of non-invasive brain stimulation that boosts brain activity, and it was typically done in research or in clinics. And I was like, this is really cool. One, it's like $30,000 to get it done in clinic. So expensive for 30 sessions. And
It's $1,000 a session.
it's really, yeah, because you need like, it's in a full clinic, and they do like measurements first, and it's not always available for ADHD. It's most commonly used in depression. And it was like all these but the latest research was using a new waveform. It was like limited and very expensive in clinic. And then in research, they were doing all the cool stuff, but it hadn't like made its way out. And one of the limiters to that was measuring the brain in the real world. And so being able to measure the brain allows us to personalize that therapeutic and or that stimulation and improve the efficacy of it. So I was like, oh, this is so perfect, because once we had built the brain measurement device, we were thinking to ourselves, like, in what situation would we want to measure the brain? Like, why would you as a person in the world get value from brain measurement?
Actually adopt this.
Yeah.
Yeah.
And we were like, oh, we need to solve a problem for people. And while there is a greater problem, which is we can't measure the brain and we don't understand the brain, what's the more immediate problem that we can solve for people while moving this mission forward? And that's when I was like, oh, this would really help me if like we just like looked at ourselves and like, how would this help me? Like, why would I do it? And then ADHD was like the main thing.
I love that you like started out just wanting to basically collect data
do
on
cool
people's
stuff.
brains, and then you had to transition into this
Yeah.
because it just made sense for like a business.
Well, even before,
Yeah.
even more than just a business, we were like, if we had technology that could measure the brain in real world, which we now do, would people do it? No, you need the data. Like, and people will like, and you need a lot of data, and people aren't going to want to do that just for philanthropic reasons. And like, we realized that if we wanted to like action on this mission of like having the world's largest brain data sets, that we could improve the way we navigate and treat brain-based conditions, then we would need a lot of data, and we can't get a lot of data if people aren't like bought in to
If they're not
using
getting
it.
some value every single day,
Exactly.
they won't put it on.
So this
Yeah.
wasn't even like us thinking about a business yet. This is all us thinking about like, how do we get lots of brain data so we can do really helpful things with it. And then we're like, we need a reason for people to get value today from it, so that they will so that they get value while investing in this like longer term value, because we're like
Well, this longer
humans
term
and
vision.
monkeys.
Yeah.
Yeah.
Exactly.
So we need a short term benefit, and like that's been really incredible because stimulation's been really huge for me, like improving my focus and things like that. So there's just been so much benefit to it. And yeah, I guess at that point when we started thinking about like, oh, okay, now we want to do the next iteration and the next iteration, and we've already spent all our savings on this, probably need some money, given it's hardware. And then we started thinking like, yes, okay, we should incorporate this as a company. And
Maybe go raise some money.
yeah, exactly.
Yeah.
So
For the first like tests, for the first, how big was the first batch of people that you like used as beta testers?
20.
20.
Yeah.
Did you assemble everything and make everything, in this house or another house, or did you like have to fly to China and go talk with people?
We flew to China for the first time this week. Last
Oh,
week, I just
really?
got back. Yeah. So we did order the parts from China. So that's the enclosure, the mechanical and the electrical parts, and then everything was like QA tested, so quality tested, and then functional tested here and assembled.
Okay.
Yeah.
What was the like biggest feedback from that first group of 20 people?
Mm, so many things. I think I'm so glad we started with 20 as well, like really small, so we could give them a really amazing experience. I think it was interesting to us to see the way that we thought that like everyone would be most excited about the brain measurement because we were most excited about the brain measurement, but people were most excited about the STEM. Obviously, that's what's solving their problem. So what surprised us was like how excited people were about um, doing STEM for ADHD. We call it STEM, it's the brain
Like,
stimulation.
yes, brain stimulation.
And that people wanted more sessions because in our planning we were like, let's try and make this as easy as possible. Let's do like 15 minutes or 20 minutes and make it something that like fits into their day so much. And then within like a week or two, people were like, how do I do more STEM sessions a day? Like I want to do more of this.
Is there any reasons not to?
There is a cap like that we think is a good idea. Like I guess we're like limited by the existing research. And so the
Mm.
research generally shows up to an hour being like totally all good. So we probably wouldn't go above that until we have our own research to show that that's a good idea. But we started at 20 minutes and we still haven't increased it yet. But I think we'll look at doing 2 sessions per day or a 40-minute session so people can get like more benefit. But we definitely, will stick to what has been like, well proven.
Yeah, what has been your process for like iterating from the first design to what you have now and what you're actually like, the trial 3 that you're about to start?
Mm. I think it's just like constantly like it really depends. Like it's hard to answer because we do hardware, firmware, software, and there's so much iteration across all three. I think it's just classic iteration where it's like, all right, what do we think this needs to do and have, and how do we think it needs to perform? Let's build that. What's like the earliest version of that we can build? And then sometimes we'll like get a little like carried away and build the coolest version that we really want. But we try to keep it very like what's the minimum cool thing that it needs to do. And then uh, try it with the team, iterate it, try it with users, iterate it. Um, but I think on the electronic side, it's much more like functional performance. Like how do we um, yeah, like really improve the signal quality or the data quality, and that's also true for firmware. And then software is where it gets into the fun, like user stuff. Yeah.
Yeah. I know that you talked about like trying to create a 10-star experience,
Mhm.
and I was kind of wondering, can you talk about how you came to that initially, or like who inspired you?
It's funny because I think you actually told me that uh, Brian Chesky talks about 10-star experience, but because I'm so like out of the loop on like all the like cool things that everyone like I mean I obviously like I'm like a huge fan of Brian Chesky, but it's actually my friend Tanae who told me about like we were like he's a founder of a really cool company called Whisper, but we were just having a like catch up after work, and we were talking about product, and he was like, let's envision our 10-star experience, and we were like, you know
Oh, so he just like
envisioning,
threw you on
yeah,
that
yeah,
road.
yeah. And then
Mm.
he just like asked me that question. And I was like, we usually think of it as like, what is the future of our product and like imagining the future. But I think thinking about a 10-star experience um is like it's slightly different in a way that makes you think about it a little differently. So that was really valuable. So thanks to having it's good to have founder
It's good to
friends.
have friends.
Yeah.
Um, What do you think the like advantages, or have there been any advantages or disadvantages to being based in like Sydney instead of
Mm.
San Francisco or somewhere else?
There's definitely pros and cons to it. Obviously, like you're here in Sydney, it's beautiful. Um, we're like sweating doing this right now. It's very hot, but it is the middle of summer. Um, but yeah, it's a great place to live. I think the great thing about doing a startup in Sydney, in Australia generally, is we have the R&D um, like grants that are really incredible. So you get 43 cents back for every dollar you spend on R&D, which for us is most of what we do. I mean, obviously we've been launching our beta, so now we're doing more user facing stuff. But for almost 4 years, we were purely R&D. So that really, really helped with extending our runway. Um, and then also, there's a lot of talent in Sydney in Australia. And there are not as many really exciting startups. So
So
being an
there's less
exciting,
competition.
yeah, and like being something where you're doing something impactful for the world, genuinely novel technology, like a young, cool, dedicated team who are like really like exceptional at what they do. Like there's not that many opportunities to do that in Sydney, and so you have a bit of an advantage in assembling a really good team, I think. Downsides, it's hard to raise money in Sydney. I find like it's much better in San Francisco, and then also it's much lonelier in Sydney. Like there's not a lot of other founders. I mean, there are incredible Sydney and Australia-based founders, to be clear, but there's just much less of them, and we're all over the place between Sydney, Melbourne, Queensland, so and I'm sure everywhere else, but
But it's not like you just walk
it's
into
not
some coffee
dense
shop and there's like
like it
10
is in
other
San
founders sitting
Francisco.
there.
Yeah. And so it's a lot more lonely. Whereas I find in San Francisco, everybody's ambitious, everybody's high agency. Like, you feel less like a crazy person. Like you're like, oh, there are other people like me in the world. I the first time going to San Francisco was so like affirming for me because I was like, whoa, there are other people um, like me, and I'm not like that crazy or that intense. Like I find in Sydney, I feel like I'm a very intense person, and I am an intense person. But at least in San Francisco, I find other people as intense as me, where I feel like chill, um, or not chill, but like equally as intense. And here, yeah, it's a lot lonelier as a founder. Um, and also, I think there's opportunities like that just naturally occur when you're walking around San Francisco and being there that you would never find in Sydney. So I currently we do 50-50. Like I'm 50-50 between Sydney and SF. And I feel like I get the best of both worlds by doing
Get
that.
the best of both
Yeah.
worlds. So I know like at the core, you're just like gathering a whole bunch of brain data, and I'm kind of wondering what are future things that you think you can solve. Like right now, you're solving or trying to solve ADHD.
Mhm.
What other like mental disorders
Yeah.
are you going to try and tackle?
Yeah, I mean, the cool thing is that the brain data actually allows us to find and improve other conditions more. So the core improver is actually the stimulation. Like that's the thing that's going to improve other mental health conditions. But the way that we find those out is by looking in the data. And so the conditions we're really interested in outside of ADHD is age-related cognitive decline. Obviously, our population is aging, and we want to be able to use our brains more effectively for longer. And there's a really good candidate. So we focus on the prefrontal cortex. That's the area responsible for focus, memory, impulse control, also decision making, planning, like so many different things. And we're also looking at anxiety and potentially depression. Um, but we're very focused on ADHD right now. And I think it'll be a little while till we explore those. But I think what's impactful is that with the same hardware, we're able to address those other conditions. And I think that'll be really exciting. And then from there, like what would that potentially look at like improving focus, memory, impulsivity for everyone so we can all perform at our best and reach our potential.
How do you think about having like a co-founder, and would you even start a company if you didn't know Damien?
I kind of can't imagine doing this without him. Like he's my best friend. We've been best friends for like 7 years more. Um, and I don't know. I really couldn't imagine doing it with anyone else. And there's something like uh really complimentary about
Your two
how yeah,
personalities and how you
we're like
drive.
almost exact opposites. So, um it makes things real. Like, it means that we always, like, when making decisions, we bring usually very different points of view to this decision, or like perspectives to any conversation. And we usually find something like either in the middle or on either extreme, depending on who knows more about the situation. And I think that like it's really nice to have like a well-rounded understanding of most things within our different skill sets, um, and different approaches to risk and different approaches to like everything. And also just having someone to talk to about all the stressful moments and that you're not going through it alone, I think is just like so critical to this like being like more a marathon than a sprint, like we're 4 and a
And
bit
like
years in.
surviving.
Yeah,
Yeah.
surviving and like like with your like mental health intact, because I think we're both like having a lot of fun and um like really enjoying it. And I think a huge part of that is sharing it with someone. Because when you're stressed, you're like in the shit together. And when things awesome happens, you're like, hell yeah. Like you have someone to high
Someone to
five,
celebrate
someone to
with.
cry next to,
Yeah.
someone to high five. Like I think I don't know if I could do it alone, but like when I see solo founders, I'm like, that's incredible. But I don't know if I could.
Yeah, it's just incredibly hard. Um, how did you, so I really like your like 6 core values, and I'm kind of curious how you find people who are really aligned with those things for
Mm.
like hiring.
I think we kind of test them out in hiring sometimes. And I don't know if I should give these all away because now maybe people, if anyone listens to this and they come for an interview with us, they'll know. But yeah, I'll tell you. Um, well, first of all, I'm a pretty direct person. So I'm like pretty transparent around what it's actually like working at Neurode in terms of like it's difficult and it's not like a 9 to 5 and all those kind of things. And I think people who are excited by like technical challenge and find that exciting,
Getting in the
like,
trenches.
yeah, are like, that's what I'm looking for. I'm not looking for a job that I like check in, check out. Um, and so there's that. And then things around our core values like integrity or intellectual honesty, we will, you know how everyone on their resume will like really embellish what it is they're
Yeah.
done. Sometimes we'll be like, it's incredible that you have achieved so much. Like you did this entire project. Like we'll overplay their like achievement and we'll check if they go, no, this is the role specifically that I played within that. Like if they don't, we will ask them like specifically, what did you do? But like we first start by being
To
like,
see if they'll
yeah,
just like kind of,
to say if they'll be like, yeah, and if they yes and you on the
mhm,
like, like
on the bullshit.
yeah, on the bullshit, or if they like correct you and say, actually, no, this was part of a team effort. Specifically, I did this. Because intellectually honest people with high integrity will do that. Um, so like little things like that.
What other like tricks do you have?
Um, oh, we've like I think there's just little things that you pick up about we have these like little like ideas, like some of the we're very lucky to get to work with like some really incredible people. And we have this idea, I don't know if it's true, that certain like great, let's say, electronics engineers will speak in a specific way. And it's so far been true. Like regardless of like age, gender, anything, um, like a great electronics engineer will be so detailed because they're obviously an LTM on these tiny, like little, really dense electronic boards. They will edit themselves as they speak. They'll say something and decide that that word isn't precise enough and like
And they'll change
reinterrupt their
it.
own sentence and change it. And then and so to the point where you're like, I don't know what we're talking about anymore, but you got the right word. And so they'll like almost like zoom in on their own ideas like to a point of like specificity, which is like, very helpful for electronics engineering, not so much for software, but it's like it depends. But we've found these little like tells of good engineers for different areas of engineering.
That's awesome.
Yeah.
What do you think, like in the next, 24 months, what are going to be some of like the big milestones for this?
I think in the next 24 months, the thing I'm most excited about is just getting to interact with more users. So the kind of expanding our beta and allowing that means we can get more feedback on the product and iterate it more. And so really the year is going to be filled with iteration until we see like our goal metrics around how much we can help people, which is also related to how much they use the product, so usage, because the more you use it, the better your results are going to be. And
Yeah.
so it's kind of really tied in. So it's beneficial for everybody that we figure out how to make this really fun and beneficial to use daily. So that's one of our goals in our beta.
Have you noticed that people actually, like, once they try it, they really just stick with it and keep on doing it
So far,
so far?
so far. Um, and it's interesting because, and I'll get into it in a second. And the other thing is retention. So like if people are receiving value from it, obviously they will keep using it. And so we want to make sure that we're able to deliver a large amount of value to lots of people continuously through the beta. And then we're also going to look at exploring an FDA submission. So we've already done
Yeah.
a clinical trial, seen really exciting results, and we want to take the next steps towards FDA. So far with our beta, you asked if we've seen like them using it in our first month, like 80, the first month of a beta cohort. Like I think it's 85 or 87% of people see like meaningful improvements in their first month, and yeah, and like generally the people who are seeing meaningful improvements are using it frequently, obviously, and they continue to do so because like once you've seen the benefit and had that aha moment,
You
like
don't want to
why
take
would
it
you
away.
stop?
Yeah.
Yeah.
Yeah. Okay. Do you have any other stories that are like really good, but I just didn't know to ask?
It was our first proper fundraise. So we had like angel checks right at the beginning, but it was our first time doing like
A
meeting
pre-seed?
VCs, yeah.
Yeah.
And so we didn't necessarily know what we were doing. But we had the product, it worked. We had a really cool demo. But it was really like a process of learning like how to tell the story and how to like package what we were doing in a way that made sense. Um, it definitely didn't make sense for lots of VCs. Like I think we met with like 60 people and they um didn't get it. Like
What were their main like complaints, or why did they say no?
the classic, this is too early. I was like, what does that mean? But yeah, we had a lot of that. There were a few VCs who have to say were like really awesome and spent time, like actually booked a call to tell us no and tell us why they no, but this is good because they told us why they said no and they actually gave good reasons
What were
that
those
like
reasons?
I can't remember now, but it was like things around like, and the thing is, we're still in touch with them, and
Mhm.
there are things that we couldn't like do. They weren't like, I don't like this company. They're like the ones who spent the time with us were like, I would want to come in like when I've seen these things, um, uh, or they just like didn't agree that ADHD like they didn't think ADHD like was a big market or mattered,
They didn't
or
think
was
that
the right
ADHD
use
was a
case.
big market?
Yeah, we got that.
Huh.
So like there's many things. But really it was just like we had like the technical innovation and our team. And so basically I think what it was is like we don't believe in you guys, right? Like it's probably that. um,
Fundamentally, we don't believe in you.
yeah, like you suck. So I think and no, like obviously it's on us to like give people a feeling that they should believe in us. And so maybe I wasn't doing a very good job at that, which is very believable. It was like my first raise, but it was really, really tough to and I think, every founder experiences this. Like you have a call, you like pitch your little heart out, you really believe in what you're doing, and you just everyone's like, no, no. And so like, it just feels like these like, gut punches every time. And the hard thing is like keeping the level of conviction that you have when people constantly tell you no. Um, but yeah, which was hard. And I think like it was such like it kind of makes me feel like good thinking back about it because even though it was really rough, we ultimately met the guys at Crystal Ventures and they like instantly believed in us and it was really cool to see because it was like it showed us like
Why did
a
they
lot of
have an instant
conviction.
conviction? What
I
did you guys do? What did you show them?
We showed them the product, we did the demo, and they like understood
They just got it intuitively?
yeah, they just got it. And I think that really like made me realize that it's not necessarily about it's very difficult to convince someone something about the world that they don't believe. If they fundamentally don't believe it. And so then I started realizing it's about finding people who already see the future of the world that you
And
are
your
trying to
visions
create.
align?
Yeah,
Yeah.
like you see the world one way and you see a path to a bit like a world where it looks different in a good way, and they like also see that, and And then so all you need to do is show them like the
That you're
plan
the
you have
guys.
for
Yeah.
enacting that. And I feel like if your plan makes sense and you've got like some show of
Track
like, hey,
record.
like this, like I built the thing, it works.
Mhm.
Like these are the next steps. These make sense because like I think these make sense. You also think these make sense given like we're seeing the world in a similar way. It's a lot. It makes it a lot more. Makes it a lot easier of a conversation rather than trying to convince someone the world is fundamentally different than how
When
we
they
think
just
it
don't
is.
believe it.
Yeah, like
Yeah.
exactly. Um, but I remember like a specific day I had flown to Health. Health is like a big healthcare conference in Vegas. Um, and I just arrived and I open up my laptop and I see like 5 no's and I just like it was so rough. I just like I start crying in a Starbucks. And like 2 hours from then I had to like get on like and stage and pitch to like all the people, like so many people. And I was like I'd seen 5 no's and I just felt like I remember feeling so like heartbroken just because it was like uh Damian's depending on me. Like like I have to do this thing because other people like Damian have dedicated his like the last few years of his life to this. Me too, our team. And like, oh no, I'm gonna be a failure and I have to call my parents and be like, I couldn't do it. And I remember just crying and like calling my parents and be like, what if I can't do it? And they're like, it's fine. And calling Damian and be like, what if I let you down? He was like, you're not gonna let me down. And like I think the resilience that like one support from everyone being like, you're not gonna let us down. And like it really showed me the resilience I have. So like I think it was I kind of think back on it really fondly because it like pulled that resilience out of you to be like, no, I can do this. We're gonna do it. Um, Stop crying, get it together, get on stage, pitch again, keep the conviction. Like uh it was when you know the movie moment. Like I often think of my life as a movie, but you know the movie moment where it's like you're down on your luck, like nothing's going right,
Everything's going
and you
wrong.
have to
Yeah.
make a decision, and like that's the decision is we're not giving up. And when I first flew into San Francisco, there was a batch of founders who were all raising at the same time. We all started in January. And seeing and checking in with them every month, like people would drop out and give up and close their companies each month, each month, each month. We couldn't raise and like blame it on the market, blame it on this thing, blame it on that thing. And there was a small group of us, maybe like 4 or 5, that would just like we relentless. We are not giving up on this race. I don't care. We will do it until someone gets it. We had plans for me and Damien had made like cockroach mode plans. This is what we're gonna do until we like get to, if we're too early, what are we going to do to get to the next milestone with the same amount of money that we have? Like how do we do this? There was like never a world in which we didn't do it. And
You're
so
just going to make it happen.
100%,
Yeah.
we never entertained, like there wasn't even a thought that like had occurred to us that we weren't going to do it. And I think that, yeah, it kind of reminds me of when we first started Neurode and I went to our like my university professors, the people that I looked up to so much through my university like career. And I said to them, like, guys, I'm gonna start this thing. Here's my idea. Here's the science behind the idea that, you know, I've come up with around stimulation and monitoring and personalizing it and all of these things. And they were like, don't do it. It's not gonna work. Like, I don't think the science is strong enough. I don't think it's gonna work. Now,
They just
obviously,
didn't
now we've
believe in
done a
you.
clinical trial. No, they didn't believe in this. They were like, I science is a really weird consensus thing because you think that it requires like, and it does require like novel, innovative ideas that you then use the scientific method to demonstrate does or doesn't like to, you know, build up evidence for and against this principle. Um, but it's weird. It's a weird consensus thing where people in academia, it's easier to say you're right more of the time, and it's easier to say it's not going to work than to believe that it is. And so some of my professors, it was easier and they'd more likely be right to tell me, don't do it, it's not going to work, than to say like,
Go for it.
go for it.
Yeah.
Try doing new, like something novel, and like both in science and engineering. And so they like they were trying to talk me out of it. Don't do it. And I just kind of felt like, no, like hell no. Like fuck you guys. Like I don't know, something in me was just like, no, this is what like how is science going to, or like, yeah, how is science and innovation going to
Progress.
progress if we take this like this viewpoint? I think like we should do it anyway. And so when I got the clinical trial results from our studies, being like as exciting as they
Basically
were,
matching. Yeah.
and I was like, yes, like I knew it. I knew we shouldn't like. I mean, I didn't know it. There's many times where I like, but yeah, I felt like yes, I knew it. Although obviously there were many times of like, oh my god, what if? What if this doesn't work? What if this? What if that? There's many cycles of like refinding conviction on our core idea, redrawing out the logic behind the core tech. Like I did this so many times. Um, every time I would lose conviction, I would like have to rediscover the idea and rework through like the principles behind it, the core thinking to refine conviction. But when those study results come out, I was like, yes. And the coolest thing was that one of my professors, like 2 years later, called me saying, like, I want to start a startup. Can you give me like and commercialize this research that I'm really excited about? Like, can we talk about it? And it was so cool to really encourage him to do that. Um, yeah. And so it was a very full circle moment. But I think that like basically the thread there is like being really resilient, whether it's like fundraising, like people just like always telling you no.
Have
Um,
you tried to be kind of a voice of when have you met with any founders who considered or were considering like giving up or whatever, and you helped them steer
actually,
towards the
yes.
better path?
Yeah. Um, one of my founder friends um called me and did the traditional like VCs suck. They don't get it. Like this is like I'm giving up. And I was like, and I gave them I was I was like, no. One, check throw that victim mindset right like out of the door. Like, do you hear yourself? Two, like it was like a staged intervention. And his company's amazing. And I was like, you're not, there's no way
You're not
you were
giving up.
throwing this away. Like, get it together. This is like your movie moment. This is your turnaround. Like, I feel like I think narrative in your own world is so helpful to like being resilient, where you tell yourself the story of what's really happening. Because you can tell yourself the story of like, investors are not getting it and the world is against what I'm trying to do. And this is, like really hard and not possible. And therefore I should give up. Or you can tell yourself the story of like, this is what did I expect it to be easy? This is
It's
obviously
a bump on the
challenging.
road.
This is a
Yeah.
bump on the road. Like this is, and when I hit the other side, it's going to feel so good because I had this like extra challenge. And so, yeah, I sat him down and I was like, you're not doing that. You're going to keep going. And your company's incredible. You just need like one person to recognize that. And this is your like comeback story. And yeah, he kept going. And actually, like, because I was so adamant that he not quit, I was like, and I will introduce you to every, not that anyone's interested in my company at this point, but like I will introduce you to every VC I know. And then actually, he's from San Francisco, but funnily enough, an Aussie investor that I introduced him to ended up investing in his
Investing.
company.
Oh, that's
And
awesome.
yeah, and they're doing really well. And he just submitted to the FDA, like, I don't know, a
Is
month
he
ago.
another like health company?
Yeah.
Awesome.
So
Um,
so glad for the world that he
that he
didn't
didn't
give
give
up.
up.
Yeah.
Yeah. What is so final question.
Mhm.
What's the hardest thing you've overcome?
I think the hardest thing I've done is working on Neurode, but also the like most rewarding and most fun I've ever had. Um, for all the same reasons, like you're navigating the unknown constantly. Um, over an extended period of time, you make a lot of sacrifices in like your everyday life in order to do something like exceptional. And I think like trying to do something exceptional is like the first step of actually doing it. But then you also have to make exceptional sacrifices and like live a very different like lifestyle than a lot of your friends probably. Um, maybe
You have
not
to
if you live
choose
in
that you
San
really
Francisco,
care
but
about it, and
yeah.
yeah.
Yeah, and like the amount of self-belief is insane. And I think that it's something that like I've definitely like been building up. Like I'm not the person who like was just born being like, I can do literally anything and like I'm amazing. Like I'm definitely not that
How do you think
person.
you like went about building up that conviction in yourself to a point where you can actually say fuck you to these people that you looked up to?
I mean,
And then obviously you're not
with the
actually
most
doing that,
love.
but yeah.
Yeah. Uh I don't I think that's where having a co-founder is really helpful, because often your co-founder, kind of like your best friend, see you in a way that you don't even see yourself. So having like support from them to be like, oh my God, I don't know what I'm doing. Like everyone just told me, like everyone I looked up to just told me this was a bad idea. And then being like, no, you went from first principles. Like you're good. You're a good neuroscientist. You understand, like you went from first principles. You have this idea. There's no reason, just because these four people said it wasn't a good idea, it doesn't actually change any of the logic behind this. Like, no, we're going to keep trying to do this. Like, do you still believe 1 + 1 = 2? Like in your own, first principles logic as to why this would work. And I'm like, yes. And he's like, okay, well, so like that doesn't change anything. So having that person who sees you as smarter than you see yourself, more capable, is really helpful. But then also I like to like remind myself, I'm like, of like my life, that things that I've done so far. And I'm like, has anything not worked out in any like horrible way? Like, no, difficult things have happened many, many times, but like you've never not overcome them. Like you're still doing the thing. And so I try to remind myself I've done really hard things and I've overcome everything so far. So hopefully, why wouldn't
This
I be able
probably
to
will be
do,
okay.
yeah, this
Yeah,
probably will be okay. Like, why
I've heard
wouldn't I be able to do this next time? Um, yeah.
I've heard Sam Altman talk about basically when the first like world shattering, everything's failing event happens, it's really scary. But when the seventh or eighth one happens, at that point you're like, okay, well I got past the last seven or eight, so
Yeah,
it's
yeah,
probably fine.
exactly. Um, and then I find it really helpful. Uh, I question everything. I'm like always questioning uh everything around me, and therefore also always questioning my own logic and my own ideas. And so this can be really helpful, but it can also get to a point where it's not helpful. Or like I think it's always helpful, but it's not always pleasant. And so like, for me. And so I find it helpful when I have like I'm in a moment of like doubting something, to like be like, all right, well, like let's rework through first principles ideas of this, and like, do I still like end up in the same place? And if not, cool. And I understand something more deeply now, and I have like more conviction on it, and so that I can believe in myself and it more strongly. Or it's the same thing, in which case I'm like, cool, another point of like thumbs up towards this idea, um, and it gives me like more confidence to do it. Also, I try to like have like songs that make me like pump me up and make me like believe that anything's possible. So
I remember I don't know if this is right, but I'm pretty sure that Travis Kalanick from Uber had like a playlist that he would do before investor meetings or whatever in the early
oh
days.
yeah.
Yeah. Um,
Oh, and like optimistic nihilism really helps.
optimistic nihilism. Okay, so tell me about optimistic nihilism.
This is a big thing, but it's like uh basically the idea that like you're basically insignificant. Like the universe doesn't really care about you. You're just like a speck. So that's very freeing, because it gives you it reminds you that you're not this like the center of your own, like yes, you're the center of your own universe, but like you're basically insignificant. So you can fail massively and nothing
No one
matters. No one
cares.
cares. You can like succeed really incredibly and nobody cares. Like hopefully the world's better, but like even Earth doesn't really matter in the grand scheme of like the universe potentially. Like through but like that is can be really positive, because it allows me to try really hard, like try anything, um, and know that like the outcome to the greater world doesn't really
As
matter. So
long as you
it's
just
just like,
succeed eventually, it'll be okay.
and if I don't, it also doesn't like
At
nobody
least you
cares.
tried.
At least like in my own personal world, yes, it'll be devastating and I'll be crushed and all those things. But like, um, really nobody else cares, and it's like it gets rid of all the like anything around embarrassment, any caring about what anyone else thinks, any like fear of public failure. It's really just like me being disappointed in my own like self, and my own like not reaching any potential that I think I have or want to have, an impact that I want to have. But
I also want to know, how did you come to the kind of like mental framework of questioning everything? It's kind of I feel like this is very similar to just asking why a whole lot,
being
and
an
you
annoying
basically
kid.
yeah. Well, I know. I mean, it's funny that you'd call it that, and people might consider like a kid asking
Mhm.
why a bunch as annoying, but then when it comes to building a company, it's actually extremely useful
Mm,
uh, to be constantly got like questioning the requirements and stuff. And like,
mm.
you know, I know that Elon talks a lot about like, does is it like a law of physics, or is it just some law someone made up, and maybe law can be changed.
Yeah, true. Literally the question that started everything with neuro, like, is this a physics thing? I think being deeply curious as a person, like I always have been, and always just wanting to understand why things work how they work. It's why I studied neuroscience. It's why Damien studied physics. It's like we just both had questions about how and why things work the way they do, and um, wanting to understand that just from different perspectives. Like me with the brain, him with like
Technology.
everything. um, so uh, really, it's just like a deep curiosity for understanding. Um, and I think understanding is the first step for everything else that comes after. Like, if you understand something, then you can apply that understanding in novel
Novel ways.
situations,
Yeah.
or you can influence a system that you understand, or yeah. So I think it just comes from always wanting to understand how something works or why we're doing something. Yeah, and I think the like more things you understand, the more your like view of the world is enriched, because you're only able to I think yeah, the more you understand, I think what
The like fewer
drives
errors
yeah,
between your reality and the actual reality.
I
Or
have no idea about actual reality, but potentially I think the more that I learn, I feel the more like enriching my life is. And it like colors your perspective and your world so much more. And so it's just like an obsession with understanding and learning things that me and Damien really share. Uh, Selfishly for my own like enjoyment of life and general curiosity, but it really applies to how we can do things faster and better. What sort of like limiting beliefs we have and where they come from, and uh, a great way of making like product decisions and um, yeah, super helpful
everything else.
everywhere. I think. Yeah.
Okay. Perfect. I think that's a
Cool.
great place to leave it.